What we advise our patients to do is find someone at the school to be the leader of their concussion team to inform everybody else that you've had a concussion. Now, that might be a guidance counselor, it might be a school nurse, it might be an athletic trainer, it might be the assistant principal. But that person should be informed by you and your parents that you've had a concussion. These are the symptoms you're experiencing, and these are the recommendations that the doctor has given you in terms of what activities you can and cannot do. And can you, as a staff, now design this education program to help this student reintegrate into school and recover? And it might mean that some teachers have to accept the fact that that student may not be in class for a week or two, or may only be able to do a minimal degree of homework and no tests until his or her symptoms have really almost recovered completely. So you have to have a point person who works with the school staff and can put everybody on the same team.